Good morning. Good to see you all. Good to hear you all. I do like to hear that. That's people that work together enjoying each other's company. I hope you've enjoyed the health food in the wings. If you didn't, grab one on the way out. We're happy to have Brian Carter from Diversified Insurance with us here this morning. Diversified is our broker for all of our benefits. This is our second year going into a business partnership with Diversified. They do a good job for us. We really enjoy Brian. He's very knowledgeable, and he's going to answer all of your questions. I make this point. We in HR dabble in insurance and benefits. We'll do our best to answer your questions. Brian is an expert in benefits. So if you've got a question, please ask it to Brian. And if you're too shy to ask it out here in front of your peers, just hang around, and we'll see if Brian can hang around and answer your question one-off. So, take it away, Brian.
Hey, guys. Thanks for being here. So, last year we had whole bunches of material that we passed out to you guys. So, we're real excited this year. We've got just this one booklet, and a whole bunch of the stuff that we've handed out before is now all going to be online. So, you're not going to have to fill out any of those paper forms or go through any of those things that we had to last year. So, huge steps, and we're excited about that. And Bradley's going to talk just a little bit more about that and those steps at the very end. With this booklet, we're going to go through each one of the different benefit plans, and we're going to talk a little bit about open enrollment and what that's all about. And as we're going through, feel free to stop me if you have questions on the benefits that we're talking about, okay? The goal here is to make sure everybody leaves feeling really comfortable with the benefits and the way they work and understands how they can get their needs taken care of during the year. All right? So at the very beginning of this booklet, if you want to open that with me, at the very front in the first page, there's a page there with a whole bunch of different contact information for the carriers. So you've got customer service phone numbers and websites for each one of the carriers. One thing I want to talk about on these websites is that they continue to put more and more information on those websites every year. So with Blue Cross, you can create your own login there on the Blue Cross website, where you're able to go in there and you're able to see the claims that have been billed to Blue Cross during the year on your behalf. You can see how much has been paid, how much has been credited towards your deductible, how much you have left until your out-of-pocket maximum's been met. If you're taking a prescription that's a name brand prescription, you can see right there on the website alternatives to those prescriptions and look up those prescriptions that you might be able to take in lieu of the name brand prescription that you're taking. They've also got the provider directories on the website there. So you can look up your provider, you can search by zip code, you can search by gender, by specialty, by languages spoken, so all kinds of different ways that you can search for a provider. And then once you pull up a provider, you're able to see which of the networks they take. And we'll get more in depth into the different networks that we have available to us in just a minute and how you distinguish between those on the Blue Cross website. On the other websites, again, Guardian on both the dental and the vision plans, and that's a change this year, moving to Guardian. But you can do the same thing and create logins there. You can also view all of your providers for both your dental and vision plans. Towards the very bottom of the page there, you can see there where it says Employee Advocacy Team, and it's got a phone number and an email there for the advocates at Diversify. I know many of you have worked with the advocates at our office in the past. If you do have an issue with a claim during the year, a claim gets denied, and you've gone back and forth with Blue Cross, you're unable to get that resolved, feel free to get our advocacy team involved, and they'll work through that with you. Oftentimes they can look at a claim and they can say, oh, I know why this was denied. It was, your provider billed it wrong, or it was Blue Cross is processing it this way, and they can figure out real quick how to resolve that. If it's something that's more involved, they can help you file an appeal with the insurance carrier and appeal that denial. So they're happy to work through those things with you. And if you are feeling some frustration with the insurance company on a particular claim, feel free to get them involved. Any questions there as far as resources during the year? Okay, let's go on to the next section then. The next two pages have a whole bunch of fine print there. So I'm not going to go through all the details here, but I'm going to summarize a little bit about what this is about. So what these two pages are talking about is that right now is your open enrollment period. This is the time that you've got to make changes to your benefits. So what open enrollment is, it's this period of time every year as we're leading up to January 1st, where you're able to come in and you're able to enroll in new benefits. You're able to make changes if you want to cancel a particular benefit, if you want to add a spouse on that's going through their open enrollment, their place of employment, or maybe you want to jump onto your spouse's plan and cancel your coverage here. All those changes, now's the time to do those. Whatever enrollment decisions you make in the plans, you're locked into those decisions until this time next year when we have open enrollment again. So it's something that we do once a year, always leading up to that January 1st date when the changes are effective. There are a few exceptions. When I say you're locked into those decisions, there are a few exceptions to that rule. So there on page 4, there's a list that says a qualifying change of status occurs for the following. So if you get married during the year, you get divorced, if you have a new baby or you adopt a child, or there's a death in the family, or if your spouse loses their job or loses their benefits of their job. I won't go through the whole list, but those are all times in which you can make changes to your benefits. So you can enroll in the benefits anew, or you can add a dependent onto the plan. When one of these changes do occur, you've got just 30 days to make changes to the plan. The most frequent ones, obviously, somebody gets married or they have a new baby. You need to add that dependent on within 30 days. Otherwise, you have to wait until open enrollment again the next year. Okay? So make sure you make those changes within 30 days of those qualifying events. Any questions on qualifying events? Yes. Great question. So just so everybody can hear, she said, if you're 25 now and you're enrolled in your parents' plan, when you turn 26 and you lose coverage on your parents' plan, is that a qualifying event? And yes, the answer is yes. So anytime you lose coverage from another source by no fault of your own, so it's not you just deciding to opt out, but you lose coverage, then that's a qualifying event. Same goes for your spouse. So if your spouse is under the age of 26 and they're enrolled in a parent's plan, if they were to hit that age of 26 during the year, that would be a qualifying event for them, and you'd be able to add them onto the plan at that time. That's a great question. Anybody else? Questions on qualifying events? Okay, moving on. On the next page, there's a section there that says waiving coverage. And I don't normally spend a lot of time on this section, but it's especially important this year. So there on the bottom of page 5, if you choose to waive coverage at Property Solutions, that's great. We'd encourage you to waive coverage. If you want to enroll in a spouse's plan or you're eligible to enroll in a parent's plan, that's fantastic. Feel free to do so. But you do want to make sure that you have insurance coverage somewhere. Okay? It's really important that you have insurance coverage elsewhere or somewhere, especially this year. As part of the healthcare reform legislation, it requires that everybody carries insurance. If you do not carry insurance, then starting the 1st of January here of 2014, they start to assess penalties. So when you go to file your taxes for the 2014 plan year, or I shouldn't say plan year, but the calendar year, your tax year of 2014, when you go to file your taxes, it will ask you when you file your taxes if you carried insurance throughout the year. And if you answer no to that question, then there is a penalty assessed in the form of 1% of your income. There's a minimum of $95. I don't think many of you are going to bump up against that minimum, but 1% of your income. Next year, it goes to 2% of your income in 2015. And then in 2016, it goes to 2.5% of your income. And it continues to go up at the rate of medical inflation after that. Okay? So it's one of those things where you want to make sure you're carrying insurance either here or elsewhere. Now, just while I'm talking a little bit about healthcare reform, and that's really kind of a misnomer in that we refer to it regularly as healthcare reform, but it's really called the Affordable Care Act. And the reason I make that distinction is really it did nothing as far as reforming healthcare itself, but rather they tried to make rules that would make it easier for everybody to get access to care. Okay, so one of the things that they've done to make it easier for everybody to access care that you've all heard a whole bunch about in the news lately are the exchanges. Okay, so here in Utah, and most all of the other Republican states have all elected to use the federal exchange for individual plans. So if you are not offered health insurance from your employer, then these exchanges are set up as a way for you to go and get insurance. Okay, so that's what you're hearing a lot about. So anybody that's not offered insurance from their employer, that's where they can go to get insurance. Right now, those exchanges aren't really working, as I've heard you. I imagine you've all heard a lot about. We do anticipate to look at those exchanges up and going by the first of the year. It's going to be tight. But when they do, those people that do not have insurance offered from their employer, if they make less than 400% of, if their income, their household income is less than 400% of federal poverty level, they're eligible to go to that exchange and receive a subsidy. Again, it's contingent upon not having affordable coverage offered to you by your employer. And again, affordable is kind of, a broad term, right, or a subjective term, affordable. Please know that everybody here at Property Solutions is offered affordable coverage by definition of the Affordable Care Act. Bradley. Okay, so Bradley's question is, let's say you are offered coverage by your employer, as all of you are here at Property Solutions, but you decide you want to go to the exchange anyway, and you find something you like better there. How does that affect you? How does that affect the company? Well, because the company is offering affordable coverage to all of their employees here, there are no penalties on the company if you do decide to buy coverage through the exchange. For companies that do not offer affordable coverage, they have to pay a penalty for their employees that go to the exchanges. Now for you, when you go into that exchange and you look at the premiums inside that exchange, you will find that the premiums inside that exchange for comparable plans to what you have at Property Solutions are going to be dramatically more expensive. And the reason for that is that Property Solutions covers about 2/3 of the cost of your insurance plans here. Okay? In the exchanges, you would not be eligible for any subsidy, so you'd have to pay that full cost. So you could certainly go to the exchanges and you could still buy a plan there. Just know that it would cost you a lot more than it does through Property Solutions. Okay. The last thing I want to say about the healthcare reform legislation is that there were a number of taxes and fees that they put on the employers. One of those being there's a fee to help pay for that subsidy for those individuals that are not offered affordable insurance by their employers. So they're taxing the employers that do offer affordable coverage to their employees to pass on those subsidies to those that do not receive affordable coverage by their employers. Well, that tax, has contributed greatly to the increased costs of the plans, across all employers, and Property Solutions is no exception. So that's the biggest tax. But there's two other taxes that go into that as well, and between them, we're looking at about 7% of our premiums this year. There was an increase of about 7% that's just due to the healthcare reform rules and legislation. Okay, so it was a big increase that the company was hit with just with those new taxes and some of the required plan changes and things. And so with that, our increase here at Property Solutions, I certainly can't blame it all on the Affordable Care Act, but a good chunk of it, that 7% there, was due to healthcare reform. The rest of it's due to utilization by the company, by you, by each one of you. So as we use the benefits during the year, the insurance companies keep track of that utilization, how much we're using the plans. And at the end of the year, their goal is, well, we can't lose money on these benefits, right? On the benefits that we're offering. So if they're not running profitably or they're losing money, as they did last year, then we see a bigger increase. So this year, Property Solutions was hit with a very sizable increase. So actually an excess of 20% this year, where we had to make some changes to the benefit plans to make that a little bit more palatable. At the end of the day, I think you'll find that we came up with some pretty creative solutions to make it work for everybody, hopefully without having a huge effect on your pocketbook or taking away coverage from you. So I think the company's done a real good job. But keep in mind that a lot of things that are going on politically, does have an effect on you guys directly in the form of increased costs and plan changes. Okay. Anybody have any questions on anything you've heard about healthcare reform, how it's affecting you? Anything there that you want me to address that I haven't touched on? All right, well then let's get into what you guys are all excited to hear about. Let's talk about the medical plans themselves and the changes that we're going to see this year. So starting there on page 6, you can see that we've got 3 different medical plans available, just the same as we did last year. Last year, we had one plan that essentially had 3 different networks, and the plan worked the same except that you chose a different network. This year, we're changing the benefits a little bit. You'll see that this first plan, the one here that says Focal Point Network on the top of it, is the exact same plan that you had last year, okay, on the Focal Point Network, no changes. On the Value Care plan, the next plan on page 7 there, the deductible goes up a little bit. So instead of a $500 deductible, it's a $750 deductible. And then on the last plan, on your traditional plan, the one with the biggest network there, it's a $1,000 deductible plan. And that's pretty much the only change. We'll get a little more into detail in those, but let's start with each one of those benefits and talk a little bit about why it works that way. So again, on this Focal Point plan, if you look at the bottom of the page, you'll see on the cost, what it's costing you as an individual for that plan is actually less on this plan than it is on either of the other two plans. So not only do you have a lower deductible on this plan, but you also have lower premiums. And you say, well, how can that be? I've got a lower deductible, a better plan with lower premiums. Well, it all comes down to the network. So with these three networks that Blue Cross offers, they have different discounts with the providers. So what that means, with our largest network, if you go to a provider, they may bill, say, $1,000 for a particular service, or that may be the agreed upon amount. But on the Value Care Network, they may only pay them $900 for that particular service. And on the Focal Point Network, it may only be $800 for that same service. Okay, so they're paying the providers less money based upon which network you choose. And so they pass that savings on to you guys in the form of a better plan with lower premiums, because it costs them less when you go to receive care, because they have to pay those doctors and hospitals less money than they do on the other plans. Does that make sense, what I'm talking about there? Okay. So the way the plan itself works, at the very top, you'll see your single deductible is $500 on this plan, and $750 on the Value Care, and $1,000 on the traditional. That deductible only applies to major services that you have during the year. Things like hospitalizations, surgeries, major diagnostic work like MRIs or CAT scans. That's the time when you have to worry about the deductible. For the things that you see on a more regular basis, your office visits, your prescriptions, your urgent care visits, even your emergency room visits, you just pay a copay for those services. You do not have to pay a deductible. Okay? So let's say you do have one of those major services. So let's say during the year, I'm going to pick something that's real common here at Property Solutions. One of you has a baby, okay? So you're going to pay that deductible first. So you're going to pay that first $500, or that first $750, or that first $1,000, okay, depending on which plan you chose. Okay, so you're going to pay that first. Afterwards, it's going to be covered 80%. You're going to be responsible for 20% of the cost. Well, they want to put a cap on that so that you know, well, if I have to pay 20%, obviously 20% can amount to a lot of money if we didn't have a cap. So there's a cap there on how much that is. So there you see that single out-of-pocket maximum. So that means the most that you will have to pay for any one individual is $2,500. Now, one of the changes to that out-of-pocket maximum, last year we called it a co-insurance maximum. Okay? This year it's a true out-of-pocket maximum because it includes your deductible in it, and it also includes each of your copays. So everything's included in that out-of-pocket maximum. So what that means is once you hit that $2,500, everything else is covered at 100% as long as you're seeing an in-network provider for covered services. Okay, does that make sense? So that's a nice bonus, a nice change to the benefits this year, is that it's very predictable now. Previously, you could continue to have to pay those copays for the remainder of the year. Your deductible wasn't included in that. Everything now is included in that out-of-pocket maximum. Okay, is everybody following me on that? Yes. Right. Yep, so good question. So his question is, let's say you go in to have that baby, but not only does mom have that delivery, but the baby also has complications, and we both hit that out-of-pocket maximum. So that means you've got two people in that family counting towards that out-of-pocket maximum. So mom's going to cap at that $2,500, and baby's going to cap at that $2,500. And at that point, you've met your family out-of-pocket maximum. So anything else that the family has during the year is all covered at 100%. Okay, great question. Anybody else? Okay, let's go through the rest of the benefits real quick there. On your prescriptions, you can see those are broken out with copays. So because your prescriptions have copays, you don't have to pay the deductible on those. So you just pay a $10 copay for generic prescriptions. You pay 25% of the cost for preferred name brand prescriptions, and you pay 50% of the cost for non-preferred name brand prescriptions. Now, usually, if your prescription falls into that non-preferred name brand prescription category, it means that there's a generic alternative. And I say usually, there are a few exceptions, but it actually costs the insurance company more for those prescriptions in that tier 2, the preferred name brands. And the reason being is that those are generally the name brand prescriptions that are still under patent. So they don't have generic alternatives, and so they generally charge more for those tier 2. So it's not just a matter of them making you pay the most for the prescriptions that are the most expensive, but rather they're making you pay the most for the ones where you can usually take a generic. Okay? So if you've got one that falls in that tier 3, I want you to go to that Blue Cross website and look at that prescription, and there'll be a list there of alternatives that you can take. Talk to your doctor about potentially taking an alternative. I'm not saying I'm going to recommend anything or the insurance company is going to recommend anything, but you can get a list there that you can go back and talk to your doctor about. Okay, make sense? On your office visits, you just pay a copay for your office visit. So primary care doctors are covered at $25, specialists are $40, same as last year. Okay, you just pay a copay, you don't have to worry about that deductible. Now preventive care is an exception to that rule. You don't have to pay a copay or a deductible. All of your preventive care is covered at 100%. Okay, and if you will turn with me to page 11 in that book, there's a list there of preventive care services. So just so you understand what types of things fall under preventive, we put some examples there. And this doesn't include everything that could fall under preventive, but it gives you a good guideline. So at the top, you'll see all of those immunizations that would be included as a preventive under your preventive benefit, and then all of your screening examinations. So it includes all of your cancer screenings, such as a mammogram or a PSA exam, a pap smear, colonoscopies. All of those kinds of things are all covered under those screening examinations. Your annual checkups, your well child checkups, your well baby checkups, all of those are considered preventive care. Now, depending upon your gender and your age, you are eligible for different preventive services. Okay, so obviously if you're 50 years old, you ought to be going in and getting a colonoscopy periodically. And so there's some guidelines that are given to you both on the Blue Cross website and on the federal government's website that tells you what things are preventive care. Okay, so with that, if you go onto their website and you look up the preventive care services, you can put in your age and your gender, and it'll tell you what types of screening exams you should have each year. Okay? Any questions on preventive care? Yes. Yeah, so influenza is listed under the immunizations and vaccinations, so flu shots would all be covered as preventive care. Good question. Any other questions on that? Okay, one last thing I want to touch on preventive care is just that if you go in for a preventive care visit, but while you're there for that preventive visit, you ask the doctor to treat you or diagnose a problem that you've got. And if it happens frequently, you go in, you're thinking you're just going in for a checkup, right? And the doctor says, well, is there anything else that's been bothering you? And say, oh, come to think of it, my knee's really been bothering me. I've got this knee pain. So he does an exam on your knee to see if he can diagnose what's wrong with your knee. Well, at that point, it's no longer considered a preventive exam. It's now going to be billed as a diagnostic exam. And the reason for that, mainly, is that providers get paid more for a diagnostic exam than they do for a preventive screening. Okay, so they're definitely going to bill that as a diagnostic exam. Okay, so I'm not saying don't talk to your provider, don't get those things treated that you need to. I think that's important. That's what the insurance is for, right? Just know that instead of being free, you're going to have to pay that $25 copay. Okay? Hopefully $25 isn't enough to steer any of you away from getting help with a condition that you need help with. All right? Anything else? Okay, let's jump back into the plans then. So if you go back there to page 6, we'll keep going through the rest of those benefits. So after the preventive care, you can see under your lab work. Blue Cross does the lab work a little different than most of the other carriers. And this is a pretty neat benefit the way they set it up, in that they give you a bucket. And it's a $400 bucket that you can spend for each individual in the family. So you have a $400 bucket, your spouse has a $400 bucket, each child has a separate $400 that they can use that pays for lab work out of that bucket at 100%. So let's say you go in and you need a strep test done, or you just need some blood work done. Those are just going to keep coming out of that bucket, and they're going to be paid at 100% until you've used up that full $400. But you're going to find for most of your minor things, they're going to be relatively inexpensive. A strep test is like 20 bucks. You know, most lab work tends to be less than $70 for most lab work. So $400 is going to go a long ways. The things that are going to exceed that, if you have a major diagnostic service like an MRI or a CAT scan, it's going to blow right through that $400. Well, you still have coverage. Just the way it works at that point, it rolls over to your deductible. So the first $400 is covered at 100%, and then you pay your deductible if you haven't paid it yet for the year. Just remember, that deductible is just once per calendar year. So if you haven't paid that deductible yet, you pay that deductible, and then it's 80/20 after that. Okay, does that make sense? Okay. After that, after your lab work, you can see your urgent care is listed at 50%, or excuse me, a $50 copay, and your emergency room is a $250 copay. So it's a big difference, right, between an urgent care visit and an emergency room visit as far as what it costs you. Why do you think that is? Because emergency room's more expensive. That's right. So anybody want to venture a guess as to how expensive an average emergency room visit is? $2,000, pretty close. Anybody else? It's about $1,400 right now is the average visit. There's certainly ones that do exceed $2,000 and some that are going to be less than that, but average is $1,400. And anybody want to guess what an average urgent care visit costs? Sorry? What was that? $250? Actually less. It's about $140. So it costs you a tenth as much to go into an urgent care as it does an emergency room. Okay, so that's why your copay is so much less for an urgent care center. We had a meeting with where a CEO of one of the hospitals was presenting just a few weeks ago, and we asked him in that meeting. We said, "How much of the care in your emergency room is done for things that are actually emergencies?" And he said that less than 30% of the care in that emergency room were for things that were actually emergencies. The other 70% were for things that could have been treated in a doctor's office or an urgent care center. So things like colds and flus and stitches and broken bones and all those kinds of things can all be treated in an urgent care center. Okay? Many of them are open late, and there are even some that are open 24/7. Okay? Yeah, first question over there. So his question is, what would be something that you couldn't take to urgent care? If you are having trouble breathing, if you're bleeding uncontrollably, if you're having chest pain, you think you're having a heart attack, all those kinds of things, those would be considered an emergency where you would go to the emergency room first. Don't stop at an urgent care on your way. Get straight to the hospital. Next question was over here somewhere. Was it you? No? Over here? Okay. So urgent care and emergency. So if in that booklet you can see under emergency care at the hospital, it says see in-network benefit. Okay, if you're really having an emergency, so one of those things I just listed, the trouble breathing, uncontrolled bleeding, you think you're having a heart attack, all those kinds of things, those are considered true emergencies. You go to the nearest hospital, okay? You don't need to worry about whether that hospital's in network or not. If you think you're having a heart attack, get to the nearest hospital, okay? Now, if you've got an emergency where you can go to the nearest hospital that's in network, then at that point, make sure you do. If you are really having an emergency, and it has to be determined that it really was an emergency, then they will pay any hospital as if it were in network. So you'll be responsible just for that $250 copay, and they'll pay for the rest. Okay? Make sure you don't abuse that because it generally results in a little bit of a fight with the insurance company if they don't think it was an emergency when you do. Okay? Certainly, when you're laying in the back of the ambulance, we don't want you to have to worry about whether or not it's an emergency or which hospital they're taking you to. Okay? So in those instances, whatever hospital the ambulance takes you to is going to be considered in network. No, there could certainly be other emergencies. So if you're having a heart attack and you go to the nearest hospital, it'd be covered in network. Okay? If you're bleeding uncontrollably, they're going to consider that a true emergency. They're going to treat it any hospital you go to. Yep. Yeah, so we've got a list of hospitals in here, so it's a good point. We've got a list of hospitals in here. We do not list all the urgent care centers, mainly because there's just so many of them, it would take up a lot of room. But if you go to that Blue Cross website, and we'd encourage all of you to do this, you can search for an urgent care center, and you can search by zip code. So take your zip code and search for urgent care centers, and you can see all the ones that are covered in your network. So when you click on them, it'll tell you whether they take focal point. They'll tell you whether or not they're on the value care or the traditional. Now, real quick on those names, Blue Cross tends to change their names on their plans frequently. Okay, so that value care plan, they often refer to it as their PPO plan. Okay, and the traditional plan, their biggest network, they just call it their participating network. Okay, and the PAR, yep, so PPO or PAR. And focal point is actually listed out. I haven't seen them invent a new name for focal point yet. So focal point's listed out. The other two might be abbreviated just PPO and PAR. They've been saying that they're going to change that. I do not know if it's changed on the website yet. So if you can't find value care or traditional listed, then keep those in mind. Yep. Just Wasatch Front. Uh-huh. Yeah, so the Focal Point network just covers the Wasatch Front. They don't have any hospitals outside of the Wasatch Front. Value Care has hospitals throughout the state, and so does the traditional network. So Bradley's question is, what about traveling? So if you're traveling to another state, how does the coverage work if you're traveling to another state? One of the really nice advantages of being with Blue Cross versus just a provider that has coverage here locally is that they do have coverage throughout the country. Even if you're enrolled in the Focal Point network, you can use Blue Cross's national PPO network. So they've got providers in every state. In most states, they're actually the largest insurance company or the largest network in that particular state. So you can always look up an in-network provider in one of those states. Now, again, if you do have an emergency, a real emergency in one of those states, then you just go to the nearest hospital. You don't worry about trying to find out whether they're in network or not. When you go to the Blue Cross website, you can put in a zip code. So if you're searching for a provider, you can put in a zip code and it'll even kick you out to their national Blue Cross website to look up a provider outside of Utah. If you want to go directly to that, it's just BCBS. So Blue Cross Blue Shield, bcbs.com. And then you can look up providers in any state. Question back there? Well, so her question is there a list of things that are considered real emergencies? And it really, I get it's a very subjective thing, and the insurance company sees it as subjective. So even in your contract, it defines it as treatment where not seeking immediate attention would cause further harm or could be life-threatening. That's it. That's the best definition they give us. So if you think that not seeking immediate attention could cause additional harm or could be life-threatening, it's considered a real emergency. Otherwise, it would not be. Okay. If something does come up where you feel like it was a true emergency, Blue Cross doesn't, it's one of those things we frequently file appeals on. Generally, it's something we can go back to the insurance company and say it was subjective. Obviously, they thought it was an emergency. You weren't there. We generally win those types of appeals. Okay. Any other questions on that? Okay. Last thing on those plans. You can see after your copays, everything else says 20% AD. AD stands for after deductible. Okay, so that's all those major services. So let's say you have a baby or you're hospitalized or you have surgery during the year. You're going to pay that deductible first, then you're going to pay 20% until you've hit that out-of-pocket maximum. And again, once you hit that out-of-pocket maximum, the rest is paid for at 100%. Okay? Now again, the only difference between these other plans, as you see when you jump to the other plans, all the copays are the same, but your deductible is different. So it's a $750 deductible, which again adjusts your out-of-pocket maximum. Instead of being $2,500, it's $2,750 because it includes that deductible in there. So your deductible is $250 higher, and your worst case scenario is $250 higher. On the largest network, on that traditional network, it's a $1,000 deductible, and your out-of-pocket maximum goes to $3,000. Okay, so again, your deductible is $500 higher, and your out-of-pocket maximum is $500. Everything else on the plan works exactly the same, other than the number of doctors that are listed in the provider directory there, and then those deductibles and out-of-pocket maximums. Okay, so again, when we were trying to figure out how we were going to approach this renewal, the thought was here, let's try and make it as seamless as possible or as easy as possible for the employees. If you look at the rates on the bottom of the page on that Focal Point network, your rates are exactly the same as what you paid last year. So there's no change at all to your rates. And the plan's exactly the same. So for you guys, no change at all. Now, if you're enrolled in one of the other plans, your rates changed a little bit, but not a lot, but you've got that increased deductible. So if you look at it and you say, well, with that increased deductible, there's two ways of dealing with that. You either switch to a smaller network to decrease that deductible, or you offset it by putting money into your flexible spending account. And then you've just got extra money in that flex plan to pay that deductible if it does come up. So it's really, something that's fairly easy to solve from an employee perspective. Either switch to a network that has fewer providers, to get a lower deductible or put money in the flex plan. And we'll talk more about the flex plan in just a second. Okay. On that list of hospitals that's covered on the plan there, well, first, I guess before I jump to that, on page 9 there's a thing there that says finding a doctor is quick and easy. So it gives you instructions on finding providers on the Blue Cross website. Just step-by-step instructions there. And then on the next page, you've got that list of hospitals. Somebody asked about that list. It is just the Wasatch Front that's listed here. There is also one omission. So there was a new hospital that just opened. It's been almost 2 months now, I think, since that Lone Peak Hospital opened there in the Draper area. So it's obviously one that's fairly close to you guys. That hospital is covered in all 3 networks, in Focal Point, Value Care, and Traditional. Okay. Yes. So our question is there any issues with pre-existing conditions? If you haven't been enrolled on the plan previously and you jump on, the answer is no, absolutely not. There will be no pre-existing condition limitations at all starting the 1st of January. So previously, if you didn't have prior coverage enrolled in the plan, they could administer pre-existing conditions. That's going away altogether starting January 1st. Good question. Anybody else? Any other questions on the medical plans? Okay, if you guys have anything you're unsure about, any concerns on those, feel free to come talk to me afterwards. Maybe you got a particular procedure that you didn't want to announce to everybody that you're concerned how it would be covered. Again, feel free to come ask me about that afterwards. All right, on the next plans here, if you jump with me to page 12, we'll go through the dental plan. We're excited about the changes in the dental plan. We are changing carriers. So we've been with Humana previously, and we're changing to Guardian Dental. Okay, Guardian's a great company. They've got the 2nd largest network in the country and one of the largest networks in the state of Utah. We did a provider match here with providers that you guys have been using here in Utah. They matched up really closely with your providers and even had a few more than what you have today. So some of you that have been seeing providers that have been considered out of network, there's a chance that they might be considered in network now. So you want to go to that Guardian website and check. Also, even if your dentist was in network previously, double check and make sure they are in the Guardian network. Like I said, it was a really close overlap, but there were a few exceptions there. So make sure your dentist is still considered in network. There are some nice enhancements to the dental plan. So some of the day-to-day benefits work exactly the same as they have in the past. So your deductible is the same. It's still $50, same as it was before, maximum of 3 deductibles per family. Your preventive services are covered at 100%, and it waives your deductible for those preventive services. Okay, now real quick on preventive services, there are some limitations. If you look towards the bottom of the page, the exams and the cleanings, they just cover 2 per calendar year on the exams and the cleanings. On your panoramic x-rays, when they put you in that machine, it goes all the way around your mouth, they just cover that once every 5 years, same as it did before. But if your dentist is doing that every time, your preventive care is not going to be considered free. And then the bite wing x-rays, they'll cover those once a year on the bite wing x-rays. Okay. On your basic services, this includes all of your fillings, endodontics, periodontics, all of those fall into there, where those are covered at 80%. You do pay your deductible on those, so you pay that $50 deductible. Again, that's once per calendar year, and then they're covered at 80%. Your major services includes crowns, bridges, dentures, complex surgical extractions, and implants. Now, that implants is a new benefit on this plan. So implants are one of those services that are becoming more and more common. It used to be everybody would always get a bridge to replace a tooth in there. Well, that means that they essentially grind down the 2 teeth next to it. Now they're doing implants more frequently, but dental insurance companies have been really slow to catch up. So your previous plan did not cover implants. This one does. Okay. Another awesome benefit on this is that the previous plan did not cover orthodontic care. This one does cover orthodontic care for your children. Okay. Not for you, for your children up to the age of 19. Okay, and those are covered at 50% up to a maximum of $1,000 on those braces. Braces cost a lot more than $1,000, but $1,000 will really help offset part of the cost there on those braces. Now there is a maximum per year. Back at the top, that 3rd line down, there's a $2,000 annual maximum. That annual maximum is the most that the dental insurance company will pay in any given year per person. Okay, so you've got $2,000. Your spouse has $2,000, and each child has $2,000 they can spend with the dental insurance company. Question? Got it? Any other questions on the dental plan? Yes. Ignore the unlimited section. It is $1,000 per braces. So I'm not sure why it says unlimited at the top. It is $1,000. Thank you. Good catch there. Any other questions? Yes. The 1st of January. So his question was, I currently have Humana. When do I start using Guardian? It's the 1st of January. So if you still have a maximum that you haven't used up with Humana, and you have dental work that you think might cost more than your maximum, use everything you can with Humana this year so that you have a fresh new annual maximum with Guardian next year. Okay? So dentists are used to doing lots of dental work in December because everybody's trying to get in before their annual max resets. Hope you can still get an appointment and use some of that up. Okay, let's jump over to the vision plan. So our vision plan is also changing to Guardian. Okay, the reason for this had a huge increase with the Emeritus plan that we had previously, so we are changing it to a more traditional vision plan. This is probably something that some of you are used to if you've had vision coverage elsewhere. This is a very common, very popular plan. We are using the VSP network. VSP is one of the largest, maybe most respected vision networks throughout the country. They primarily focus on private practice, optometrists and ophthalmologists. Okay, the way it works, you pay a copay for each service when you go in. So if you go in for your eye exam, you pay a $10 copay for that eye exam. For your prescription glasses, you pay a $25 copay for those glasses, and then there's a cap on the frames. So you pay a $25 copay for the frames, and then you get a $130 allowance after that copay. Anything $130 allowance, you get a 20% discount off of those. For your lens options, if you want a progressive lens, you pay a $55 copay. If you want a standard scratch resistance coating on there, you pay a $17 copay. So essentially there's copays for every service. And then your contacts, you got a $130 allowance for your contacts. Anything above that, you get a a 15% discount on it. Yes. Great question. So his question was, what's the difference between the vision screening that's covered in the, everybody's pretty excited about something up here. I don't know, spider. Is a spider going to land on my head? Okay. So the vision screening covered under the medical plan is just for the health of your eye. Okay. So it doesn't include a prescription for glasses. This here is going to include a prescription for your glasses. Okay. So it'll include the eye dilation and all of that. Yes. Right. So if you're getting the progressive lenses, that's where you pay that $55 copay. If you're getting just standard lenses, you just pay that $25 copay that you see above. So even whether they be single vision or bifocals, you just pay that $25 copay. The higher copay, that $55, is if you're getting the special lens, the progressive lenses. And once you pay that copay, the rest is covered. They only have 4 providers where? Yeah, that's not accurate. So you must have been looking at a different directory. So VSP is actually, I'd say, okay. Well, maybe we'll have to go through that, but they do have a lot more providers than that. I'd say they've got dozens of providers in Salt Lake County. So they've got dozens of providers in Utah County as well. VSP is one of the largest vision networks anywhere. So I can go on to the website after this meeting, and if it seems complex to try and find a provider, maybe we can send out some step-by-step instructions on how to find a provider with Guardian. Okay. All right, let's move on to the life insurance. The life insurance benefits are on the next page. At the very top of the page, you'll see the benefit that Property Solutions is providing to you. So they're providing $50,000 of basic life and accidental death and dismemberment to all employees at no cost to you. Okay, so those are covered at 100%. So that way that works. If you were in the event of your death, your beneficiary would receive $50,000. If your death was caused by an accident, it would be an additional $50,000. So that accidental death and dismemberment essentially doubles your life insurance benefit. If that $50,000 isn't going to cover your family's needs, we'd encourage you to buy additional life insurance, and there's a section there for voluntary life insurance. Now, for all of you that are just newly eligible for the benefits, when you go to purchase this, they have a guarantee issue amount up to $200,000 where you don't have to answer any health questions. So under that employee section there, you can see that. So this is for those that are newly eligible for the benefits. Everybody was eligible when we first rolled it out last year to get that $200,000 without answering any health questions. Now, if you would still like to purchase additional life insurance, but didn't do so previously, you can purchase all the way up to 5 times your annual earnings, not to exceed $300,000, but you do have to answer health questions if you were eligible for it previously and didn't enroll. Okay? There's an evidence of insurability form, an EOI form, that'll be on the ADP website for you to be able to fill out there. You can also purchase coverage for your spouse. You can purchase anything up to $300,000. You can't exceed what you purchase for yourself. And anything up to $30,000 for new individuals, you're eligible for up to $30,000 of guarantee issue amount. Yeah. Yes. So you do have to purchase coverage for yourself to be able to buy coverage for your spouse, but you can purchase in those increments of $10,000 up to the $300,000. You can also purchase coverage for your children up to in increments of $2,000 up to $10,000. And on the next page, it's got the rates all broken down. Now, when you go into the ADP website, when you go to purchase the life insurance, it'll actually make all the calculations for you. But it's relatively simple. These are rates per thousand. So as I look around the room, I'm guessing the average age in here, I don't know, it's got to be pretty low, maybe 25 to 29. So if you look at that 25 to 29 age bracket, it's 5.5 cents per thousand. So if you want an additional $10,000 in coverage, you're going to pay 55 cents per month for coverage. If you want additional $100,000 of coverage, it would be $5.50 to buy additional $100,000 of coverage. Okay, any questions on that, life insurance? Okay, towards the bottom of the page, you can see your long-term disability benefit. This benefit is, again, provided 100% by the company. You don't have to pay anything for this coverage. This is a benefit that's way overlooked in that the way this works, it kicks in after you've been out, once you've been out disabled for 90 days. So it could be a sickness, it could be an injury, it could be whatever. Once you've been out 90 days, then it'll pay you 60% of your salary up to $6,000 a month, all the way up until Social Security normal retirement age. So we know a number of people with various companies that were involved in an accident or had a disabling illness that are going to be on these disability payments for the rest of their life, and it's going to pay them 60% of their salary all the way up until they hit that Social Security normal retirement age. The reason they have to do that, obviously depending on your age, Social Security is going to define normal retirement age differently. So for some of you, well, maybe nobody in this room, it could be 65. For those that are younger, it could be 67. Okay? And I anticipate that'll continue to creep up. Well, your disability will pay until that date. Yes. Good question. So there's a couple limitations there. So your own occupation is 24 months. So what that means is, let's say you're really specialized in your job. So they're going to pay you that disability benefit if you can't do that very special job description that you have today. After those 24 months, then if you can go back to work, they expect you to do so. But they don't expect you to go back and flip burgers. So it's any job that would be commensurate with your education and your previous pay. Okay, so that's what those 24 months are there. So it's really just for those that kind of have a special job description that they may not be able to do. Then those other two, those limitations, so mental abuse, a mental illness limitation and substance abuse, on both of those, there's a 24-month limitation. So if you become disabled as a result of substance abuse, then they'll pay out a benefit for just 24 months. For mental illness, it's just a 24-month benefit where it'll pay for just 24 months. Everything else, all of those more traditional physical illnesses, it'll pay up to Social Security normal retirement age or illnesses there. Okay. On the next page, there's an opportunity there for you to buy short-term disability. So the way this benefit works, this benefit kicks in after you've been out for 14 days. So hopefully you got enough PTO to carry you to those 14 days, and at that point it starts paying on the 15th day. And The purpose of this benefit, and the reason we give it to you as an option to buy, is that for some of you, you're looking at that long-term disability and you're saying, boy, 90 days out, by the time I've gone 90 days, I've already had to file bankruptcy. It'd be devastating to go 90 days without a paycheck. If you don't have savings or something to carry over 90 days, we would encourage you to purchase the short-term disability benefit, where it's going to kick in right there after you've been out for 2 weeks, and it's going to pay you 60% of your salary up to a maximum of $1,000 per week, and it'll pay out all the way until when that long-term disability benefit kicks in. Okay? And the rates are there below. It's $10. It's a rate per $10 of weekly benefit. There's a calculator there below to be able to calculate that. Any questions on the disability plans? Bradley? So his question is, what's the difference between the short-term disability plan and something like an AFLAC plan? Okay, so AFLAC plans, you all see the commercials, right? They're going to pay you if you're sick and you can't work, right? Well, the way those work, they're usually based upon a particular condition. So they've got, cancer plans, they've got critical illness plans, they've got accident plans where they'll just pay you a lump sum. So if you're in an accident and you break an arm, it'll give you $400 for a broken arm. Or if you get diagnosed with cancer, they'll give you a couple $1,000s when you're diagnosed with cancer. Okay, but it's just a one lump sum payment. It's not necessarily tied back to your income or for any particular period of time. These here are more all-inclusive than an AFLAC plan would be. While serving the same purpose, it's going to be more comprehensive. Okay, so it doesn't have limitations on what types of conditions. It doesn't have a lump sum particular thing for particular things. If you can't work, it's going to pay you. Okay, did I cover what you were looking for there, Bradley? Great. Yes. Maternity leave, absolutely. In fact, the most paid out claim on the short-term disability is maternity. So you can't be pregnant when you enroll in the plan. So there is they're under the pre-existing limitations. So if you were diagnosed with something within 3 months prior to enrolling in the plan, then you have a 12-month waiting period for that particular condition. Okay. So anything that you've been diagnosed with in the previous 3 months is going to be excluded for the next 12 months. That makes sense? So if you're currently pregnant, then you would not be able to purchase the short-term disability for this particular pregnancy. Okay, let's move on. Last benefit, I think, and then we'll let you guys get out of here, is your flexible, actually we have 2 left, so bear with me for just a minute more, is your flexible spending account. First thing on your flexible spending account, can anybody tell me why, let me back up just a little bit. Your flexible spending account is an account where you can take money out of your paycheck and set it aside to pay for medical, dental, and vision expenses that you incur during the year. Anybody tell me why would you want to put money into a flexible spending account? Pre-tax, exactly. So that's the biggest one. That money that's coming out of your paycheck, you don't have to pay any taxes on that money. Can you tell me any other reasons why you want to put money in a flexible spending account? You can use it all up front. So this is the other one. It's easy for budgeting purposes. So let's say you're going to have a surgery done during the year, and you're going to have to pay that $500 deductible or that $1,000 deductible, whichever plan it may be. But you can set that full $1,000 aside up front into that flexible spending account, not up front, but you elect that $1,000, and each pay period that's coming out of your paycheck, but you have access to that full $1,000 at any time during the year. So if in January you have that, you have to pay that deductible, you can use up that full $1,000, and then the rest of the year, the money that's coming out of your paycheck goes towards paying that back. So those are the 2 big reasons. Obviously, predictability, being able to budget and have it help you, pay those big expenses up front, and the other one's the pre-tax benefits. So I saw a hand before. Yes. Okay. Yeah, so her question on the short-term disability, let's say I just talked about the exclusions for maternity. If you're already enrolled, there's no exclusions. That's just for somebody coming on newly. So no exclusions for those of you that are on there. Just the initial exclusions when you first enroll in the plan, anything that you've been diagnosed with in the previous 3 months are excluded for the next 12. All right, so back to the flex plan. It works really easily. Now, I guess the one thing we want to talk about here is we talked about the reasons to enroll in the flex plan. Why would you not want to enroll in the flexible spending account plan? You lose it, right? So if you put money in there that you're not going to use, at the end of the year, you lose that money. Now, we have done something on this plan to make it easier. So on this plan, any expenses that you, or any money that you set aside during the 2014 year, you actually have until March 15th of 2015 to incur expenses related to that account. Okay, and then you've got what is it, 30 days? 30 days after that to be able to submit those receipts. Okay, so you'll have a debit card that's tied to this account. You can swipe the debit card at the pharmacy, at the doctor's office. You can pay your copays, you can pay your deductible, you can pay your dental bills, you can buy glasses with it. All of those things you can use your flexible spending account for. Any question on the flexible spending account? Yes. So his question is, do you choose how much you put into that? So if you look under that section in the middle of the page, so the maximum amount you can put in there for 2014 is $2,500. So you can choose anything up to that amount, up to $2,500 to set aside there. Any other questions on that? Yes. Yes, you can use it for braces. What about what? Hearing aids. I clearly need some. So yes, hearing aids would be a covered expense in there. The last benefit there, your dependent care reimbursement account, works the same as your flexible spending account. You're able to pull money out of your paycheck without paying any taxes on it, set it aside. A couple differences there. Obviously, your dependent care expenses are very predictable, so you're not making so much of a guess at the beginning of the year how much to set aside there. You can set up to $5,000 aside in that dependent care reimbursement account. That amount is a maximum per family. Okay, so you can't elect $5,000 here and have your spouse also elect $5,000 at their place of employment. Okay, so it's a maximum of $5,000 per household. The flexible spending account, however, that $2,500 limit, that's a maximum per employed individual. So if you elected $2,500 here, then your spouse could also elect $2,500 with their employer. Okay. Yes. So his question is, he recently had an expense that he saw a doctor for and hasn't yet received the bill for it. Could he make the election for 2014 and pay that bill with the money that he sets aside in his flexible spending account for 2014? Unfortunately, the answer is no. So it has to be for expenses that are incurred during that calendar year, all the way up until March 15th of 2015. Okay, so only for expenses incurred from January 1st to March 15th of 2015. Bradley? On the dependent care, the care who the provider is. They do need a tax ID number to be able to pay that dependent care provider, reimburse that dependent care provider. It can be a family member as long as they are a daycare provider and can they'll be claiming it on their taxes, the income that they receive from your flexible spending account. Okay. All right, any other questions? Okay, the next page just tells you a little bit about the debit card that you'll receive from Discovery, and there's some sample expenses on page 20 of things that are eligible for your flexible spending account. These are just sample expenses. The idea behind this is just to get your minds working on some of the things that you could set money aside pre-tax for, and that's what that list is for. There's a lot of things that are covered that are not listed on here. And then the last page there is on your employee assistance program. And this is a great benefit. It's provided by Reliant Behavioral Help. And what it is, it's a hotline where you can call in and you can get help on a number of things. So you can get counseling for anxiety or stress, parenting counseling. They've got a 24/7 crisis line. They've got, if you've got questions on, elder care, or you've got, parents that need some assistance, you can call in and get assistance with that. If you have legal questions or financial questions, there's a whole list of things there that they can help you with. And this is all included for free. It doesn't cost you anything. It's completely confidential. They don't send a report back to the company that says, hey, your employee called in because he's really stressed about the way his boss is treating him. So none of that. So it's all completely confidential. Okay. So if you need help with anything, there's a great resource there for you to be able to go to. All right. Anything you guys have questions with that I haven't touched on? Okay. Yes. So his question is there a reason we're doing a flexible spending account rather than a health savings account? Well, there's a number of reasons. And was it considered? Absolutely, it was considered. So we actually looked at health savings account type plans. So to be able to have a health savings account, you have to have a high deductible health plan. All of our deductibles, including the $1,000 deductible plan that we have on that traditional, are lower than the minimum required deductible to have a health savings account. So technically, our health insurance plans are too rich for us to be able to offer a health savings account. We looked at offering a higher deductible plan and then supplementing it with a health savings account, but the cost savings in doing so just didn't make any sense this year. The difference in premiums between the low deductible and the HSA was so minimal that there wasn't any savings left to put into a health savings account. So it's something we'll continue to keep on the radar, as we know that there are some nice advantages to health savings accounts. But for you guys this year, we're able to offer better benefits by not going that route. Okay, great question. Anybody else? Okay, that's it for me. Bradley's going to just talk for a couple minutes about how to enroll on the new ADP portal.
So did anybody notice what was not in this booklet? What was not here? The forms. The forms. The enrollment forms. Why aren't the enrollment forms in here? Because you're doing it online in ADP. You should be getting an email if you haven't already from HR with where to go and what to do. There'll be a few screenshots, very straightforward, very simple process. First, make sure that your dependents are all there. And then on the left side, all the benefits are listed. You walk through the benefits and then either enroll or waive. When you're all done enrolling, you have an opportunity to print a confirmation statement. It will show you the benefits that you've got as of the date you're looking at the page. So make sure you change that date to 1/1/14 to see what you just enrolled in, to see what your benefits for 2014 are going to be. Then make sure that everything is the way you want it to be. You've got up until December 3rd to make any changes, and we are here to help. So happy enrolling, and thanks for being here. See y'all.